So now the last competency for this week and for this domain, compelling vision, which is earning trust and loyalty. So we looked at developing vision as the first step in this domain, compelling vision. We learned that vision is more than strategy. It's the ability to anticipate future. How do you recognize opportunities? How do you design a roadmap that would inspire confidence and direction? And leaders who do this well don't just react to the change, but they stay ahead of it. Then we looked at competency 4, communicating vision. Vision, no matter how brilliant it is, it cannot live in silence. It has to be communicated clearly, it has to be communicated widely, and it has to be communicated consistently. A vision that is vague or only spoken once will quickly fade away. But when leaders tell stories, they connect the vision to purpose, they narrate patient experiences, they repeat this message in different meaningful ways, then they would be able to bring the people along with them in this journey. So that will lead us to the last competency in the compelling vision, competency 5, earning trust and loyalty. Because of vision, even when it is clearly communicated, will not inspire or lead to a lasting action unless your team trusts the leader who is speaking. Trust is the foundational element what transforms vision from words into a shared commitment. It is what convinces people to follow you, not just in terms of excitement, not just in times of excitement, but in times of uncertainty and challenge. They want to see you as a leader who will walk the walk the same way you talk the talk. So as we move forward and discuss, we'll explore how exceptional leaders earn trust and loyalty, not just by the authority. Authority, yes, it helps. At the end of the day, the trust is earned by authenticity, the authenticity you bring to the table, the consistency by which how you display it, and a willingness to lead by example. So together, these 3 competencies, it forms the foundation for a leader who can create, who can communicate, and who can sustain a vision that truly moves the organization forward. So let's take the first step. What is earning trust and loyalty? Let's take a moment. Think about the leaders you have trusted most in your career. Chances are they weren't perfect, but they were consistent. They were honest and they were transparent. Trust is not just a nice to have in leadership. It is the foundation that allows everything else to work. Without trust, even the best strategies and the most compelling visions will fall flat because people don't feel safe enough to follow. Loyalty builds when leaders admit their mistakes, when they can portray that they're also human like other team, when they show empathy during difficult times, and when they create openness in the workplace. For example, think of a hospital CEO who, instead of hiding a medical error, openly acknowledge what happened. Not only he or she acknowledges, but they can share what they were able to learn and what changes they're going to bring and the commitment to build a safer hospital. That transparency doesn't weaken their credibility. Rather, it strengthens it. The staff would walk away saying that this is a leader I can stand behind. So we can see this in practice at Cleveland Clinic. They built their reputation not only on excellent clinical outcome, but in constantly cultivating trust with patients and staff. Their motto, patient first, was not just a slogan. It became embedded in their culture. When the hospital introduced mandatory empathy training for all caregivers, it was a visible action that reinforced their words. Patients felt they were heard, and staff felt they were supported because the leadership consistently modeled openness and compassion. It became part and parcel of their everyday interaction. The result? Simple: higher patient satisfaction and very strong employee loyalty. Another example that comes to my mind is Mayo Clinic, where teamwork is central to their culture. Physicians and nurses know that leadership consistently backs them with a collaborative model rather than just glorifying the individual stardoms. Over decades, this consistency has built deep loyalty. Clinicians join Mayo not just for the brand name, but because they trust the system to honor their contributions and support them in putting patients first. Ultimately, leaders earn trust not with big speech, but with little things they do every day: showing up, listening, keeping their word, and treating others with respect. Over time, these behaviors accumulate into loyalty. And loyalty is what keeps team together when challenges come. So when we talk about earning trust and loyalty, we are talking about leaders who are honest, transparent, and consistent in both their words and their action. And when that happens, people don't just follow, they stay committed. Now let's take a look at how highly effective leaders earn trust and loyalty. We saw and discussed earning trust and loyalty is not just about a grand gesture. It's about a daily practice that shows and demonstrates to people that they can rely on you. Now let's take a breakdown on how this has been accomplished. The first and foremost is being accessible. Leaders who are approachable create psychological safety. I remember a hospital chief operating officer who made a point to walk the halls every morning. She didn't just ask, "How is it going?" She stopped to listen. And when a nurse shared a concern about staffing, she followed up by bringing it to the leadership table. That accessibility made staff believe their voice truly mattered. I remember even in MD Anderson, I met our chief operating officer in a conference and I shared my innovation, my journey of innovation that came directly from patient experience and a caregiver experience. He was very appreciative of what I have done. She promptly connected me with the chief technology officer, and she wanted to make sure that the chief technology officer can take the necessary steps to direct my innovation to the next step. So if you think about chief operation officer of a large organization, at any given point of time, they would have an overflowing list of priorities. So if they can listen to the concern of the nurse, if they can appreciate the contribution made by an administrator and ensure the necessary action has taken place, that speaks volume about being accessible of that particular leader. Next one is encouraging openness. So great leaders never pretend that they have all the answers. They build trust by being honest, even when it is uncomfortable. For example, during the height of the pandemic, some hospital CEOs openly admitted we don't have enough protective equipment. But here is what we are going to do to fix it, or here is what we are doing to fix it. And here is how you would be able to help us. That honesty paired with vulnerability definitely draws staff closer. And also, it gave opportunity for the staff to own up to the problem and see how they would also be able to contribute to solve it. The third one is being authentic. Staff can spot insincerity immediately. One physician leader I worked with always shared personal stories why patient safety mattered to him. He lost a family member because of a preventable error. That authenticity wasn't a rehearsed authenticity. It was who he was. And he genuinely expressed it. And that expression gave the power to his message. It inspired others to take safety protocols seriously. And his authenticity was well known in the different units that he worked. The fourth one is modeling behavior. Modeling behavior is another powerful way leaders can earn trust. If you ask your team to put patients first, you have to model that. The reports I read at Mayo Clinic, executives are known for leading by example, even in small ways. If a leader says no one is about teamwork, but then he goes back and he refuses to collaborate, he gives excuses for not collaborating. And if there is a team member who is not collaborating, he is doing everything by himself or herself, and the team leader supports it, the credibility is lost instantly. But when leaders consistently live the values in both words and actions, the staff immediately follows. Finally, it's about turning trust into loyalty. Trust is the foundation, but loyalty is what makes people stay through the hard times. Let's go back to Cleveland Clinic. When they embedded empathy, training all staff, making sure all of the support has been provided, the employees felt supported and valued. That kind of consistency in living their vision turned everyday trust into deep loyalty. Staff didn't just work there, they stayed, they advocated, and they become ambassadors for the organization. So when we talk about highly effective leaders, we are talking about leaders who are accessible, who are open, who are authentic, and who are consistent. Leaders who understand that loyalty doesn't just happen overnight, but it grows from month to month, years to years, building trust step by step, one decision at a time. It is a meticulous effort that has been demonstrated by each leader. Now let's take a look at when earning trust and loyalty falls short. It is very hard to build trust, but trust is extremely fragile. It can take years to build loyalty, to build trust, to build that foundation. But in order to lose it, it's just one incident, 1 second to lose it. Let's take a look when leaders fall short in earning trust and loyalty. First is everything that we discussed in the previous slide as opposite, being unavailable. When leaders are detached, when they're absent, people perceive, people interpret as indifference. I know a health system where the CEO was rarely seen outside of the executive suite. For staff, this lack of visibility created a sense of disconnect. They felt that the leader didn't understand their daily struggles. Contrast with a leader who round regularly, who listen to the staff, who participate in their activities. The presence matters. I remember when Dr. Peter Pisters, when he became the new president of MD Anderson Cancer Center, his initial months was nothing but just walking through the hallways, connecting with each team, giving his personal attention, listening to the concerns from both executives, administrators, supervisors, and frontline staff. That resonated throughout the institution, which brought him the foundational elements of trust and loyalty. So next is lacking follow-through. Nothing erodes credibility faster than broken promises. For example, a hospital leader once announced a major wellness initiative to address burnout. Staff got excited. They thought there's a new gymnasium that's going to open up. There's going to be massage centers. There's going to be like counseling, different kind of resources and support. But months went by and nothing really happened. The message became very clear. The promises were empty. And once follow through is lost, even future commitments are met with skepticism. Another pitfall is assigning credit or blame incorrectly. Imagine a project team working tirelessly to reduce patient wait times. But when the results are presented, leadership took the credit without acknowledging the team. That kind of oversight doesn't just hurt the morale, it undermines the trust that leaders are not fair and just. The reverse is also true. When blame is pushed down unfairly, loyalty quickly erodes. Then we have failing to lead by example. Leaders set the tone. If they demand punctuality but arrive late to every meeting, or stress patient safety but bypass safety checks themselves, people immediately notices it. The gap between words and actions become a credibility chasm. Staff respect leaders who walk the talk far more than just someone who just talk. Finally, accountability at two high levels. Over-centralization can frustrate staff. In large healthcare organizations, when every decision must be escalated to senior leadership, frontline staff would feel powerless. When a nurse manager cannot approve small changes in workflow without multiple signatures, the staff will lose trust in the system's ability to act. Over time, this frustration eats away loyalty. So the lesson here is simple. Trust is earned through presence, promises kept, fairness, consistency, and empowerment. When these are missed, even the best leaders risk losing the very foundation that holds the team together. Now let's take a look at misuse and overuse of trust and loyalty. Now, we talked about how critical trust and loyalty is for leadership. It's also important to remember that too much of a good thing can actually backfire. So let's talk about some common pitfalls where leaders either misuse or overuse these qualities. First is communicating too directly. While clarity is important, but being overly blunt can shut down the dialogue. For example, I remember a medical director who prided himself in telling everything like it is. While his honesty was refreshing at times, his tone often discouraged staff from raising concerns. People began avoiding him because they felt judged rather than supported. So here, trust eroded because the directness lacked diplomacy and empathy. And it's a leadership trait for diplomacy and empathy. Let's take a second one. Discouraging dissenting opinions. Sometimes leaders equate loyalty with agreement. But when teams feel that they can't challenge or question a leader's decision, innovation would suffer. Consider what happened at NASA before the disaster of Challenger. Engineers actually raised concerns about those O-rings, but decision makers prioritized schedule and cohesion. They dismissed all of these warnings. That was a tragic reminder that discouraging dissent isn't loyalty. It is dangerous. Third is overvaluing loyalty. Leaders can sometimes surround themselves with very loyal people who always agree with them. But that loyalty would always silence important challenges. In healthcare administration, if senior leaders only promote those who never rock the boat, creative thinkers are always pushed aside. Over time, the organization loses its edge because no one is willing to question assumptions. I know one of my coworkers who would challenge the leadership discussions and decisions. Unfortunately, her voice was never heard, even though she's very capable and address the risk of every discussions or decisions. It made leadership uncomfortable, which never positioned her for promotion or any type of recognitions. Finally, excessive loyalty can prevent necessary change. So if team members feel too loyal to their leader, they may resist new approaches out of fear of betraying their trust. A hospital team that stayed loyal to a tenured CEO resisted a shift to digital health solutions, even when patients were demanding it, because they didn't want to abandon the traditional ways. That kind of loyalty can hold back organizations. It impacts innovation. It brings that a group of stakeholders' voice has not been heard fully. So, in summary, while trust and loyalty are cornerstone of leadership, they must always be balanced with openness, adaptability, and a willingness to embrace dissent. True loyalty is not blind allegiance. It's the courage to challenge. It is the boldness to innovate and to act in the best interest, supporting the mission and vision of the organization, even when it is uncomfortable. Now let's take a look at how to better earn the trust and loyalty. First, in even other competencies, finding role model who would inspire trust. Many of us can think about leaders who we admire, not because they were the loudest voice, because they consistently showed integrity. There were many elements of that leader which confirmed the perspective bias that we are all carrying. That means our voice is heard, the leader has resonated with the values, principles, and morals that I am holding as a person. I remember a nurse manager who never asked her staff to do something which she wasn't willing to do herself. It even happens in physician-patient relationship, parent-child relationship. And when that happens, over time, that consistency will build unshakable trust. And the staff, the patient, the child naturally follows that lead. Learning from leaders like this would provide a blueprint on how we should be operating and earning our credibility. Second is encouraging employee feedback. As we discussed, trust is a two-way street. When leaders ask their team, what can we do better? And genuinely listen, it creates openness. One hospital CEO placed a suggestion box in the staff lounge. But instead of letting it collect the dust, he responded to every idea in a weekly email. This simple act showed staff their voices mattered and the trust soared. Third one is focus on accountability and follow through. Nothing erodes trust faster than broken promises. If a leader commits to improving the staffing ratios or fixing a scheduling issue and months passed with no change, credibility is lost. On the other hand, even small follow through actions like updating a team on progress, sending out newsletters, holding the town hall meeting on a consistent basis, it can reassure employees that leadership is serious and they would deliver on their commitments. Fourth is building resilient relationships. Trust is always tested during crisis. Think back to the early days of pandemic. Leaders who stood by their teams, providing resources, transparency, and emotional support, earned loyalty that endured long after the crisis subsided. When this happened to MD Anderson, MD Anderson shared their vision that no jobs will be cut, We will be learning from what pandemic is teaching us. We will innovate consistently. And employees from different departments volunteered, acting as guide for patients, caregivers, so that their clinical needs can be met promptly. And this, after the crisis, after the pandemic, ensured that we didn't lose employees. We were able to come back at a much faster pace during the pandemic and before, how we were operating before the pandemic. So resilient relationships are forged in difficult moments, not easy ones. Finally, commit to personal development and authenticity. Leaders who are lifelong learners, who admit mistakes, and who lead with authenticity inspire others to do the same. Employees can spot when leader is pretending or hiding behind a facade. But when leaders are open about their own growth journey, sharing, here is what I learned, here is what I fell short, it makes them relatable. Trust naturally deepens. So the message here is earning trust and loyalty doesn't come from grand gestures. It's the small, consistent choices leaders make, being authentic, being accountable, being resilient, and being open, which ultimately inspire long-term commitment. So let's take a look at the summary of what we covered. So as we close this competency, let's go through some of the key stories which would highlight how trust and loyalty can truly play out in leadership. In one of the competency, I remember we discussed Johnson and Johnson. Johnson and Johnson faced the Tylenol crisis when bottles were found laced with cyanide. The company immediately pulled all of the products from shelves nationwide. Their cost went over 100 million, but they prioritized public safety over profit. That single act of transparency not only saved countless lives, but rebuilt public trust stronger than ever. So it reminds us that decisive, values-driven leadership protects trust even in the darkest moments. Second, loyalty builds when leaders demonstrate accountability and authenticity. Think of the CEO who openly admitted when his or her initiative didn't go as planned. Instead of hiding the failure, they call all staff meeting, they share the lessons learned, they lay out a better path, and they give you more accurate milestones by which the smaller steps can be met. So the staff, seeing the humility and honesty, will never lose the confidence. They actually will become more loyal because they know that the CEO is real and they are committed to the shared mission and mission. And finally, trust and loyalty sustain leadership through challenges. So during Hurricane Harvey in Houston, many healthcare leaders and hospital teams stayed overnight with their staff, with their patients, eating the same meals and sleeping on the same cots or bed. That visible solidarity in crisis forged unshakable bonds of trust and loyalty. not because of what leaders said, but because of what they did. So in nutshell, trust and loyalty are not built on speeches or policies. They are earned through consistent, transparent, and values-driven action. They are the glue that hold organizations together when challenges hit. And this becomes one of the foundational competencies by which leadership should thrive and build on the future competencies. Thank you for an excellent week. So we have discussion questions and assignments. So I'm hoping everybody would enjoy the discussion question and can reflect your own unique values that would reflect these three competencies. Thank you, everybody.